is the last elections when we were campaigning, as I went into this community, people normally, when you go for whatever meeting, people will always stand up and seek help, because the MP is also the social security system in Kenya. So when after I've already presented whatever I was saying, so the community stands up with their requests. And normally I'll give a token, like when women stand and say, oh, I've been sick, I'm suffering this and all that. So I'll give 3,000 Kenya shillings, sometimes at most 5, because there are too many. So one of those instances, I gave a woman 3,000 shillings. And then the community told me, it was kind of a chorus. They said, no, Mheshimiwa, we need you to talk to her closely. They said she's had this problem for a long time. So she walked up to me and opened her blouse. Yes, in public. And she had a breast oozing with pus. I mean, I was so shocked I didn't even know what to do. And I took back the money and I sent my vehicle. I stopped my campaign the next day, sent the vehicle, took her to a public hospital. What was the challenge? Why she's never been? In Suba North, my constituency, the level of hospital that's there would not be able to deal with that sort of situation, because it looked like it was breast cancer. And the next place was a little far. And she can't afford 500 Kenya shillings. And eventually, I sent her to a very specific public doctor. And when he saw her, he was like, this looks like it's definitely breast cancer, but we can't even do invasive investigations, because this breast needs to dry fast. So they had to give a medication, which I paid for, which was more than 10,000 Kenya shillings. Then, of course, after that, when I was following up so that she can go back for now the proper treatment, and she's like, no, I've suffered for 5 years. Mheshimiwa has helped me, I'm not going anywhere. And she refused to go. Why am I telling you this? This is not an isolated case. This is the real situation on the ground. So I like sharing this, because sometimes when we talk, our drift goes to us. When I talk about sexual and reproductive health, I'm talking about me. Another example I'll give you is, for me, I'll come here and I say, oh, when I was campaigning, people told me they'll not support me because I don't have a child. No big deal, yeah? But I go to the ground, and women come, when I'm talking on the ground, people talk to me in groups, yeah? They say, oh, Mheshimiwa, we are here, we are the fishermen. Sort out our issues as fishermen. Then others will be like, oh, we are here, we are the farmers, we are the what? And then there's a group that says we are the Jondilo. The Jondilo are the ones who swallow. They swallow means